Let's go back to the definition of compliance. Anybody? The ease at which the lungs and the lungs are the alveoli. The lungs and the thorax distend. So we're looking at both pieces. Does that make sense to everybody? So the major pathological alterations with kyphoscoliosis are lung restriction, and potentially compression as a result of the thoracic abnormality. Now there is a potential for a mediastinal shift. Again, the severity is going to determine that. Now, something that's a little bit different with kyphoscoliosis and its restrictive component is that there is mucus accumulation. So depending on the amount of mucus accumulation, we are potentially going to have a mixed disease process here. Does that make sense? And what's not listed up there is atelectasis. Here's a question that we'll just kind of throw in there. Patients with a lateral and posterior curvature of the spine would tend to, can y'all read those? How many A's do we have? I'll give everybody a chance to read. How many A's? Yeah, that's pretty much. It doesn't matter how old you are. If you have the curvature that is going to prevent lung expansion, then you're going to have a smaller lung volumes. Oops. Okay, so I'm going to go back to the book real quick. Let's look at the etiology and epidemiology. And I'm just going to read from this section right here. Kyphoscoliosis on page 345 affects approximately, and this is FYI, affects approximately 1% to 2% of the people in the United States. So that's not a very large amount at all. Mostly young children who are going through a growing spurt. And so what happens when children, I think it's typically like first grade or third grade, I think there's intermittent, I didn't look it up, times that children are checked for kyphosis and scoliosis. I know one of my friends was diagnosed with scoliosis from the test that they had at school. And now she's in her 50s and she's had 4 children. And it was recommended that she not have children, but she did. And her curvature has gotten much worse since she had children. But it hasn't affected her lung function. But you can tell that she has scoliosis, not kyphoscoliosis, but you can tell that there is a abnormal lateral defect. Okay. With older people, what generally causes a kyphosis?
Yeah, muscle muscle atrophy. So the weakening of the muscles, there's the posture.
And their posture starts to go as their muscles weaken, and then all of a sudden you have a hunched over, and that can be severe enough to prevent a certain amount of lung volume. Let's see. And let's just look at the clinical manifestations. As the patient's breathing becomes affected because of the abnormal curvature, what's going to happen to the vital signs if they start experiencing shortness of breath? Increased respiratory rate, tachypnea, increased heart rate, tachycardia, increased blood pressure, hypertension, and they may or may not have a fever. With mucus accumulation, and if there's potential for a bacterial infection, then they may actually have a fever. So it depends. One of the things to keep in mind with these patients, if their breathing gets bad enough that they have to be intubated and go on mechanical ventilation, that they are going to be hard to get off the ventilator. They're kind of like COPD patients when they go on mechanical ventilation. So that's something to keep in mind. Their blood gases, look over there on page 348 under the blood gases, mild to moderate kyphoscoliosis, as with most initial diseases with hypoxia, is going to cause increased rate and depth. And what's that going to do to the blood gas? An alveolar hyperventilation or a non-compensated respiratory alkalosis. Everybody okay with that? Now, if the patient develops chronic respiratory failure with this disease process and have CO2 retention, then what's their blood gas going to look like on an everyday basis? On an everyday basis.
Still normal, more on the acid side.
Their pH will be normal, but more on the acid side.
It would be a retainer for CO2.
An elevated CO2.
Reduced PaO2.
Reduced PaO2, and their bicarbonate would be elevated. Now, it will be obvious, I think, to identify the patient who comes into the ER or you're taking care of on a medical floor or in the ICU that has a kyphoscoliosis versus a COPD patient with chronic bronchitis and emphysema.
Shoulder tired, yeah.
Exactly. Okay? Did y'all ever, and I know I should throw these crazy things in here, but did y'all ever see Young Frankenstein? And I forget his name now, the funny guy. And when they're going through there and looking through the lab or whatever, one point his hump is on this side, and then it changes to the other side. So if you ever get a chance to watch that, that's a pretty funny movie. It's Gene Wilder. Is that, yeah. Okay. So with the laboratory findings on page 349, this is typically when the patient has severe kyphoscoliosis. They'll have polycythemia just like COPD patients because the body is trying to increase the oxygenation with increased red blood cells. And even though that seems like a good thing, if they can't breathe in any more oxygen, what does that thick blood end up doing?
clot?
Potential to clot, but what's the probably more common thing to happen?
You have a decrease in
Huh?
Hypertension.
Where?
Would you be hypoxic?
Pulmonary.
So pulmonary hypertension, right-sided heart failure. As the right heart is trying to pump that thick blood into the pulmonary vasculature that's already constricted, what's going to happen to the right heart over time?
Enlarged.
It's going to enlarge and it's going to be impaired. And what do we call right-sided heart failure? Cor pulmonale. Some people pronounce it cor pulmonale, so you may hear either of those pronunciations. They'll also have a low chloride and a higher sodium, and that's mainly because of their change in bicarbonate. Which of those electrolytes are part of the hamburger effect? The chloride. Okay, for the chest x-ray, you're obviously going to see the spinal curvature deformity. And if it's severe enough, mediastinal shift. The areas where there's atelectasis or compression because of the spinal abnormality, you'll see white areas or opaque areas on the chest film. And the enlarged heart from right-sided heart failure. Okay, and as we talk, or as the book talks about